Good afternoon, everyone, and thank you for joining us. My name is Tariq Isaacs. I am a Whaler One man from Canamble and an engagement assistant for Cracks in the Ice online toolkit based at the Matilda Centre for Research in Mental Health and Substance Use, located at the University of Sydney. It's my great pleasure to welcome you to today's Cracks in the Ice webinar. Before we begin our webinar, I'd like to acknowledge the traditional owners of Australia and recognise their continuing connection to the land, water and culture. I am currently on the land of the Bendigo people and pay my respects to their elders past, present and emerging. I further acknowledge the traditional owners of the country on which you are on and pay respects to their elders past, present and emerging. I would also like to acknowledge any Aboriginal and Torres Strait Islander people who are amongst us today. Today's presentation is one in a series of webinars which is running as part of the Cracks in the Ice project. If you haven't already seen the website, I would encourage you to visit www.cracksintheice.org.au, and we welcome any comments or questions you may have. So feel free to get in touch with us at any time. Before I introduce you to today's speaker, I wanted to let you know that as participants, you are in listen-only mode. This means that we can't see or hear you. However, you will notice that you have a Q&A button on your dashboard. This is where you can type in questions that you have throughout the webinar and send them through to us. We will then have a question and answer section at the end of our webinar. I would also like to let you know that we will be recording the session today, and we will be making the recording as well as the slides available to you through the Cracks in the Ice website. So without further ado, our speaker today is Annalee Stearne, a Nyungar woman from Western Australia with connections to Southwest Pilbara and Kimberley regions. Since 2001, as a researcher based at the National Drug Institute, Annalee has worked with First Nations, Australian communities and organisations in WA, NT and South Australia. Annalee currently sits on the boards of the National Centre for Clinical Research in Emerging Drugs and an NT-based First Nations Australian organisation, Children's Grant. In 2019, supported by the Centre of Research Excellence in Indigenous Health and Alcohol, she commenced a PhD study exploring the First Nations Australian self-determination in alcohol-related harms in Northern Territory. Thank you for joining us. We are extremely lucky to have you with us today, and I'm sure this is going to be a very interesting session. I will now hand it over to you to make the presentation. Thank you.
Thank you, Tariq, and thank you for having me today. I want to start by acknowledging that I'm on the land of the Whadjuk people of the Nyungar Nation and recognise the strength and resilience of our peoples who have maintained a continuing connection to the land and waters in this region, a right and a responsibility that was not ceded. And I acknowledge the traditional owners and caretakers of each of the nations throughout Australia and pay my respects to elders, both past and present and emerging, and all the other Aboriginal and Torres Strait Islander people attending today. As Tariq said, I'm a Perth-born Nyungar woman. My family connections are to the Wandani Budja, which is down Bustleton or Margaret River region through my mother's side. And I've worked in the AOD space for the past 20 years, mainly evaluating Aboriginal-led interventions in South Australia, Northern Territory and WA. And I've been working on my PhD for the past 3.5 years, looking at how the right to self-determination can be exercised in alcohol policy. So today I'll present some of the findings of these and hopefully make the ones that are relevant to working with First Nations communities. Yes, I'm primarily funded through the Centre for Research Excellence in Indigenous Health and Alcohol, but based at the Curtin University's National Drug Research Institute. I'll start with providing a bit of a background context. So firstly, Aboriginal First Nations Australian population is about 800,000 people at the moment, but we still are about just over 3% of the entire population of Australia. And when we look at it more intensely and break down the population, it's very different to we're much younger than the non-Indigenous Australian population. So there's two tones on both on the left-hand side of the screen, but non-Indigenous, and the lighter coloured ones are those that are aged 0 to 9 on both, and then you've got the 10 to 25-year-olds. So 51% of First Nations Australians are aged under 25 years, and that's equivalent to, I think we've got 29% in the non-Indigenous population. And the other end of the age range, we have 17% of non-Indigenous Australians are aged over 65, only 5% of First Nations Australians are aged over 65. And that means that those of us that are in the middle of our life, we have got a lot on our plate. We are, because the population is much younger and dying much earlier. Midlife are the ones who are earning, caring, and probably dealing with significant comorbidities, simply because so many people are dying much earlier. And there's a whole history behind that. And when we look at life expectancy, this is life expectancy for women. For 2015 to 2017, it was expected, for those born in that at that time, it was expected that First Nations Australians would live to about 75.6 years, and non-Indigenous women would live to 83.4. And for males, it's a bit younger, 71 years for First Nations Australians, men, and 80 for the non-Indigenous Australians. But when we actually take a look, so this is the life expectancy, but when we look at the age of death, First Nations Australians are dying much earlier. So non-Indigenous, the green circle, the non-Indigenous Australians are dying within their age, like within the median age of death is right between the life expectancy. But for non-Indigenous Australian, for Indigenous First Nations Australians, the age of death is actually earlier at 60 years, compared to 82 for non-Indigenous Australians. But this is also an average, and the diversity and the distribution of the population is important when considering these. And there's actually some significant variation by state and remoteness. So in the Northern Territory, it was estimated that the mean age of death for Aboriginal males was as young as 50. So we look at where First Nations Australians are living. Firstly, the estimated proportion of the population in each state or territory. 30% of more than 30% of the population in the Northern Territory are First Nations Australians, and it's close. It's between 1% and 6% for the rest of the state. But we look at where those 800,000 First Nations Australians are living. We'll see that, which is the map on the right. Those we see that most Aboriginal people are living where most non-Indigenous people are living, in cities and on the East Coast. And like if you look in WA, we have a much higher proportion, higher number of First Nations Australians living in the Perth metro or Perth region. We're also really diverse. There's more than 250 distinct language groups, and about 145 of those languages still being spoken. And even people living in major capital cities are speaking their language at 30%. So it's not something that's, and those numbers are increasing thanks to many supports and languages being revived and preserved. So just to recap briefly there, we've got most of us live in cities and in the East Coast. We're diverse. We're a small portion of the Australian population, and we're significantly younger, have a shorter life expectancy and an earlier median age of death. And this is all linked to there's a history of colonisation, and intergenerational trauma that have been that contribute to this poorer health and earlier death. So the history, like I said, the history is really important. So when we talk about Australian history, it's really important to remember that Australia's been around as a nation, was formed in 1901. And First Nations Australians are yet to be recognised in the Constitution. They were excluded until 50 years, more than 50 years, just 50 years ago, but we're still not acknowledged. And linked to that, because that is the founding document, is that there's a really long history of policies which have excluded, persecuted, and been very paternalistic to First Nations Australians. And these are not necessarily just historical. We've got one in the Northern Territory, the legislation, Stronger Futures legislation, that has only just ended. So we're dealing with stuff that is actually, and we're talking about stuff that is actually really recent. So I just want to reiterate that it's really important to recognise the role of past policies, particularly if we're talking about drug and alcohol, because as long as someone's making decisions around alcohol policy for Aboriginal people, we're not going to be able to redress that history. So, and some of these measures have continued through my lifetime. So in WA, we had quite a significant Protectionist Act, but other states had very similar things. So, and these measures included state governments had extensive powers to protectionist boards that were able to regulate every aspect of people's lives, including where they lived, worked, who they married, how they spent their money. And these measures also included the removal of children from their parents, separate or maybe no education for Aboriginal children, town curfews, quarantining of wages, forcing Aboriginal people into to live in special reserves. And WA, you had to apply to be a citizen, and in that you had to give up certain rights. So the Stolen Generations have had these measures, and the Stolen Generations have had just devastating impacts for people who were forcibly removed as children, their parents, their families, and their descendants. And it's estimated that, for all these groups of people, they've experienced high rates of depression, anxiety, post-traumatic stress and suicide, poorer health, and poorer socioeconomic outcomes. It's estimated that as many as 1 in 3 First Nations Australians are affected by the Stolen Generations. However, all Aboriginal people were actually affected by the government policies, which required First Nations Australians to change in order to protect themselves and their families. The language could not be spoken. The country, my own grandmother and her mother, had to make choices and leave that between protecting their children and keeping their families, and keeping the children in their lives, or staying near their family and speaking their language and practicing their culture. And culture and connection to land and country is fractured at best. And these continue to have impacts on the health and wellbeing of First Nations Australia. So sociologists have attempted to explain why different people from different social groups are affected differently. And it's not random. And these factors are known as the social determinants of health. Things that contribute to your health, these things contribute to your health status. And when you're considering First Nations experiences and their history, overall, they've experienced intergenerational barriers to these specific areas. Health inequalities based on these social determinants have been identified in the Australian population in general and amongst First Nations Australians in particular. And it's been estimated that the socioeconomic disadvantage contributes to almost half of the disparity between First Nations Australians and non-Indigenous life expectancy in the Northern Territory. And so this is a model that's used internationally, led by, originally grown from work by Michael Marmot. But First Nations Australians have also recognised that there are other, that have recognised that other contributors, both historical determinants, the political determinants, so they're how those inform the social and impact social determinants, but also the strength and value and of cultural determinants in terms of improving people's wellbeing. And this work was done by Graham G, Pat Dudgeon, and colleagues. So, yeah, wellbeing is influenced by the history and politics, current and previous. And one key factor in addressing all of these is the right to self-determination. Or Michael Marmot recognised that having decision-making power, or having power to make decisions about and be in control of your life, can actually help you address many of these. Because if you're powerless to make even the smallest decision, it's just going to have ongoing impacts. So self-determination, it's a right, an internationally recognised right. That forms the basis of the United Nations Declaration for Rights of Indigenous peoples, but it's actually been a recognised right for many, many years. For decades, actually, it's linked to the Declaration of Human Rights. So our Human Rights and Equal Opportunities Commission recognise that all people have the right to self-determination. By virtue of that right, they freely determine their political status, freely pursue their economic and social and cultural development. And the right of self-determination is a right of peoples rather than that of individuals. So, because there are two types of self-determination, particularly in the psychology field, there's the right of the individual to have power and make decisions, but also we talk about this as a collective right. And even our Human Rights and Equal Opportunities Commission recognise that without self-determination, it's not possible for Indigenous Australians to fully overcome the legacy of colonisation and dispossession. In my PhD, we've defined self-determination as being the internationally recognised right and ongoing process of Indigenous people to collectively determine their own pathway within and outside of existing settler society. And it's a constant change. It's not something it's one-off that can be done. It's a constant thing that can be, a constant right that needs to be exercised. You can't give it to somebody. You need to allow them to exercise it. And I want to know what was necessary for First Nations Australian self-determination to be exercised in health and alcohol policy, because the policies can contribute, as we have seen with the Northern Territory National Emergency Response and the subsequent Stronger Futures legislation. So I went to some experts. One study within my PhD, we decided to run a Delphi study. So Delphi is where you seek consensus, but based on the perspectives of a panel of experts regarding what, and in our case, we're looking at what was needed for First Nations Australians to be able to exercise self-determination in alcohol policy. So Delphi is a multi-stage iterative survey where we basically repeated the survey options till we got consensus around different elements. We had 20 experts, 9 of those are First Nations Australians, and combined there was over 170 years of combined experience working with Aboriginal community controlled organisations and 200 years of experience influencing policy just from this group of experts. The data were collected using electronic survey across 3 sequential rounds in late 2020. So at that point, being in Western Australia, I was still not able to travel, so this worked well. And I have a paper published in Health Research Policy and System, actually describing this study. So, oops, I didn't. Yeah, so the outcome from this paper was a framework which has multi-level, because we found that when you talked about what was needed, it was very, very broad. And don't worry if you can't see it. I'll send this through to the team. But yeah, so there were elements at multiple levels. So we found that Aboriginal people need to be involved, as you can see across the bottom, at all stages of the policy development process, not just consultation or when it's being implemented, and that needs to be representation, involvement, and inclusion throughout the process at multiple stages. And we found that the themes that came through from the participants, from the panelists, recognised that it required change in the development and implementation of policies that affected First Nations Australians, right from a macro level, government support, federal government support, as well as state government support, to actually facilitate and recognise. And we started this just as the Coalition of the Peaks involvement was being embedded, but also during the consultations around what the previous government wanted, how the previous government would recognise or give First Nation Australians a voice or input into policy. So it's been a bit of a had to add some extra context as we've gone through. So they also highlighted the certain values that were needed at underlying all the policy development stages. Highlighted some elements that were very related to how the policy process was done, so very practical. How the decision making, specifically how decision making was done. Representation for who was involved, and this was really interesting, and the implementation of policy. So all of these were elements. I think there's a lot more that could go around this sort of stuff, but this is what came out of the study. So today I'm going to focus on two main areas. Firstly, representation, and then the policy processes, because I think these provide some really useful context. So I asked the panelists to rank. They were given each of these examples. They actually identified many of these, and they were asked to rank on a sliding scale whether Aboriginal community-controlled organisations should always be included for it to be self-determination, or whether it depends on the context, or if they were included, that it's self-determination. And that's what the focus was. It was not necessarily about who should be included. The focus was related directly to self-determination. And we had only two types of representation: those people directly affected by the policy, and the community-controlled organisations. We had 83 and 89% of participants agree that these people should always be included, or these groups. And I thought that was really, and then when I sort of unpacked a bit more, we actually saw that actually all of these remaining, so community representatives, elders, the entire community, experts in the area, they were either ranked as being always include or include depending on the context. And as for having the communities decide who should represent them, having individuals who represent their communities, and a nationally representative body should all. So I think for me, the really important point there was actually it really is dependent on the context and the environment and what you're looking at. And what came out really in that also were, because at the time when I started, Ken White had been elected and appointed as the Minister for Indigenous Peoples, Indigenous Australians. And that was a big question. Oh, now that he's there, what will that make any difference? And to me personally, that wasn't necessary, didn't actually give me self-determination. But I think it was something really important to consider. And so that was thrown in, as well as public servants. As you can see, there was still some people saying it wasn't actually all negative, but it was saying that we had 41% of panelists saying that public servants, though important, don't necessarily equate to providing for self-determination. I think it's particularly with those, and similarly 29% said that the First Nations Australians elected to government don't equate to that. And I think it's very interesting, given our current government and who has more than 10 First Nations Australians, I think, across both the Senate and the lower house. And the current discussion around Uluru State from the Heart, the voice to Parliament or the truth-telling treaty highlights that relying on individuals, even when they are in leadership, can actually be problematic. And you can see the difference coming from between the Labor Party and the Greens approach, of which comes first. So while there was little consensus, it highlights some really important considerations that individuals or one group of representation is not appropriate. The context and the objectives are really important to help inform who should be involved. And each stage of the process may actually need different types of representation. And so the next area I think that I want to sort of highlight for you is that are the elements that the panelists identified as being essential to the entire policy process. And I think these are quite important in terms of how you can work with First Nations communities. So the overarching theme for that area was that self-determination in alcohol policy requires policymakers to use processes in which First Nations Australians are and in each of these elements. So for this presentation, I've adapted that a bit so that it requires processes in which First Nations Australians, AOD interventions requires processes in which First Nations Australians are. And we had 8 across that. They're involved, they're resourced, that there's trust building, that's localised, that there's time, there's feedback and accountability and two-way sharing. So as I work through each of these, so that I think for the processes that require that First Nations Australians are consulted early in the process, are involved in co-design or co-development of the intervention or process, and involved in the monitoring and evaluation. That came out really clear that you can't. And it was quite interesting because there was only one participant who said they needed to be independent in our monitoring and evaluation. However, good research practice tells us that First Nations Australians should actually be involved in research that's about them. And the independence could come from having Aboriginal researchers or monitoring evaluation teams who are external to that community, but can approach it in a very specific and safe way. So we also said First Nations Australians are resourced and funded to be included in all stages, so that there's actually capacity for them. So it's not the power. I think that's actually, particularly policy, it's really important that there's recognition of the power, and that the inclusion in all stages. So the resourcing actually can address some of that power imbalance, and that might be just enabling people. From a policy perspective, that was enabling people to actually contribute at a federal level to things, and or even a local level. That the process enables, so the next one is trust building. So the process builds trust and relationship. First Nations Australians are relational. Our interactions are relational. And there's trust, there can be trust built in that process. So yes, and we recognise again power in that process. That so we had First Nations Australians local culture and language are considered and adjusted for in the policy making process. I think what was quite interesting when I was looking at alcohol policy in the NT, the Stronger Futures legislation brought in some very harsh penalties when they went from being the intervention that actually increased and criminalised possession of alcohol within prescribed areas up to $74,000 and/or 3 years in prison if you were to bring alcohol into a town camp or a prescribed area. And what I saw out of reading some of that was actually not understanding when they did the consultations and the evaluation of the intervention, where people say, oh, we want rules stricter, it's actually about unpacking what that means and translates to in terms of the process. I think there could have been a less persecutory approach. All right, and time. We've got pressure, particularly as a researcher, we've got this pressure to move through things quickly. We know what's needed, let's just do it. But I think if you need to give time for decision making to be done properly and time to move through it. I saw it with an organisation that I was involved in, and they said, oh yeah, we need to get our reconciliation plan, our RAP updated and done. So we've got to do this in the next 3 months. And all the Aboriginal staff that were there went, we're not rushing this. It took that organisation nearly 2.5 years to finish and update their RAP, because it wasn't just the individuals involved. They need to actually have input and take that back to the rest of the community that are involved. And feedback. One of the biggest things that came out of my one of the study and looking at what was people's experiences of the alcohol policy in the Northern Territory was actually people asking, what's actually happened? Does this make any difference? Is this actually having the effect that they want? And I think this highlighted the need for it need to be within something that's relevant, but also in a format that people understood. So if it might go in the news, a lot of people don't hear the local news. The feedback needs to come back through many different pathways, and it needed a really strong feedback loop. That the process is accountable, that First Nations or that the people doing the work, be it policymaker or someone running an intervention, that they need to be able to hold First Nation, the outsiders, the people running the work, to account through the process. Because that again is linked to trust building. And that there's a two-way sharing process, that the decision-making and power is being formed by what has worked elsewhere. So there's some really, particularly coming from, because many of the panelists were researchers working in the AOD space. They all highlighted the need for the process to actually say, this is what we know, this is what can work. How do we adapt this with the First Nations Australian participants, being able to inform and say, this is how we want to adapt it. So in short, hopefully this has been of value. But in summary, I think that it's really important to remember that self-determination is vital to wellbeing. That's more just including people, and that it's actually an internationally recognised right. And that how you do the work, how the programs run, how things are implemented is actually sometimes maybe more important, or is as important as the strategy. So we'll have this evidence-based work, but how it's done can actually undermine. I think the perfect example is that while localised restrictions worked because communities in the Northern Territory actually said this is what we want, imposing that undermined all of that power and the community ownership, and we need to remember that and take the time to actually work through and develop things that are localised. So I'd like to acknowledge my supervision team and the Centre for Research Excellence in Indigenous Health and Alcohol, the Chief Investigators, my fellow scholars, and most importantly, the Delphi expert panelists. Thank you.
Yeah, thank you so much, Annalee. That was amazing. You covered so many areas on the topic. But yeah, so we've got a few minutes now for questions. A few have already come through, but if you have any more questions you'd like us to answer, or Annalee, sorry, to answer, please submit it with the Q&A button. So yeah, I'll start it off with, so someone asked, how can peak bodies for AOD services around the country better evaluate the voices of Aboriginal community control member organisations to support self-determination in relation to AOD policy?
Oh, I have to see if I can find that one too. So how can the community controlled organisations?
Yeah, essentially.
So that's a really interesting, so particularly with the Coalition of the Peaks growing and having a role, and that for a long time First Nations Australia community controlled organisations have been the example of self-determination, because they grew in a time when the government policy was self-determination, and they responded to some beautiful examples of how, like Redfern, it was "we need something." That were the first AMS. And I think, again, it depends on the community. It depends on the community that they represent. But having boards and having an Aboriginal community controlled organisation, you have the board who are elected to represent. And I think there needs to be, by working out a way to connect with the community all the community is really important. So I can't tell you how, but I can suggest that some of those principles. So I had one former CEO of a AMS say, I think they could be doing some really innovative approaches, such as doing surveys in the waiting room, and apps are great, in developing something that actually helps them inform where they're going. But I've spoken about in one of my papers, there's a bit of and a couple of others have looked into it. There's a real, for community, for particularly medical services and health services, they're caught because they're the service provider in between the government, and the government sets the priorities. So and that's where the funding is coming from. So there's only so much self-determination that can happen when you're relying on the funder. So it's a really tough environment. But hopefully with the Coalition of Peaks, and our current government, there can be a move in terms of that. So hopefully that's answered the question.
Yeah, we got another one. How does self-determination work in terms of people's self-determination? For instance, there will be meetings of Aboriginal people in order to get a general consensus on a matter, just keeping in mind that everyone has different wants and needs.
Oh, now that also is where I think it's the localized approach. So I took I'm on the board of an Aboriginal community controlled organisation called Children's Ground, and I worked in the top end with the team up there, and I also worked for them, and I worked in Central Australia, and the local governance that both of these groups had was actually really different. The Northern Territory, so up top, we'd have a meeting, and it might be where we're going to go for learning on country, because the organisation was very Aboriginal. It was early years education. So they want to take, and part of it was we're going out country. And there was a whole negotiation that went on for maybe 3 hours one day. And that was just about one point. But it was only when people, when there was agreement and everyone was happy, that they actually moved forward, that they actually did something. Whereas down in Central Australia, the approach was we have people who've, it's a very similar process, but the governance was far more traditional, I guess. Yeah. So, and that in there it was very senior women and men, if they wish to attend, but this was very, very senior women who were the ones who then took it back to their outstations to work out what was going to happen. So and more urbanized, it becomes harder because it's not just, so in Perth, it's not just Nyungar people living in Perth. So, and those services and organisations, how do you actually get that representation?
Yeah, definitely. We have another one. How do you talk to policymakers to include First Nation peoples?
Oh, I think that's the next step once I'm finishing my she's trying to work out actually how we can actually do that. And you can have it can come down to really we need some support. So in the Northern Territory, and actually I think in New South Wales, they've been developing, they have agreements that it's part of the implementation of the closing the gap. They've got local decision-making processes. So if we're going to implement a policy or something, it goes through this, there's agreements about what they will make. So I know in the Northern Territory, they have agreements with certain traditional owners. It does get complicated. It works fine in a small defined community or outstation, but it becomes a bit problematic when you've got multiple language groups, and the expectation is to that this one group can speak on behalf of everyone in that town. And I think it still requires some work.
And in regard to like AOD and sort of, I guess, controlled substances, I know it's taught in a lot of medical schools that Indigenous people are more prone to addiction, and sort of don't really get medication that they may need at a time. How would you sort of handle that going forward, I guess?
I think some of the work that Kate Cronograve's team at Uni of Sydney have actually done is actually specifically they've done some stuff looking at, I think, I'm trying to think who's looked at the prescription of stuff of anti-abuse and that sort of thing. So they're building evidence. I think that's actually from the other side, actually having evidence. So actually, look, this is what's needed, and this is how you can inform that. So influencing policymakers around that sort of thing. It's so as we saw with that my framework, it's multi-layered, and we can't just focus on the ground, because if you keep focusing on those little implementation processes, all of the other stuff affects it. So the federal government's approach can affect. So we need to. I think there's so much more we can do to influence policies and proceed and build evidence, really.
Yeah, and what do you think is kind of next for you in this area?
I would like to look at actually how it can work. So one of the big things that's coming out, particularly here in WA, is the want for self-determination from an organisational perspective. So how we can improve AOD treatment services to meet that gap. So we've got a really good workforce. We've got we're building some really good co-design stuff, but how do you actually improve all the services so they're actually safe? So I wanted to explore that a bit more, but then at the same time, I've really enjoyed the capacity building stuff that's coming out of the Centre for Research Excellence. And I think I'd love to see so many more First Nations researchers actually leading research that has a direct impact on the communities.
Yeah, and do you think that non-Indigenous people have the skills, even when educated and trained in the area, to help with self-determination, or really in any area concerning First Nation peoples and issues specifically relating to them?
Oh, that's a tricky one. I think there are people out there who have those skills, and I think there's also space for people to improve, but also this is a learning process, and the phrase decolonisation is thrown around a lot, but actually it's about recognising there's a lot of debate going on in the Northern Territory at the moment around now the Stronger Futures restrictions have gone, the alcohol is more available, and that itself is quite political, but the government there is really trying hard because the decisions were race-based. But here's some very strong voices talking about protecting communities. And at some point we have to let people make decisions, but it's around to me, it's around allowing everyone has things to learn and grow, and space to learn and change.
Yeah.
And I think it's a tough space to actually, no one's automatically going to be able to do everything, because there's power changes in that. And there's stuff that policymakers literally can't do because the power still sits within the departments, and they have to follow procedure. I think that's what happened with the intervention. It didn't matter who resists. Like it was a mandate, and it happened.
Definitely. And this is a good one. Is there a place for traditional healers and our own traditional foods and medicine in policy making when it comes to residential AOD programs? And how can we better incorporate these into practice?
Oh, that's a very local, that's a really good question, really localized
Mm.
approach. I think there is some moves, particularly in South Australia and the Northern Territory. I think in South Australia, I believe they're facilitating the Lunkaries to come into hospitals. And I think AOD space, there are also places where some of the treatment, I think there's some treatment rehabs in New South Wales. I'm not going to name it because I can't, I might get it wrong, who actually have some traditional healers in the culture coming through. I think there is a place for that, whether you're in, and because there is a spiritual, to me, there's a spiritual element of healing when it comes to that sort of stuff. So it's not just the physical, psychological. I think it doesn't matter what spiritual background, and I think that's where that can play a place. I think it's so there is a place, and it is I think working with the local community, but also looking at who's coming through. The importance of the importance of a local a welcome to country and acknowledgement to country connects, particularly for First Nations Australians who might be outside of their traditional country, because that's where it's come from. Is as we traditionally moved through country, it had to be invited in, and that itself is can actually help promote healing and wellbeing.
Yeah, and we've got another one from Donna regarding
Yeah.
consultation in the community. How do you best manage conflicting views, particularly between people of their own country and other First Nations people who are from the same areas but are in area of number of generations, but have been in an area for a number of generations? Sorry.
That one is really tough, and you sort of see that conflict. I don't, and I think that's really tough. I actually haven't seen anyone really negotiate it really well as an organisation. So there's every area I've worked, in regions I've worked, there's been conflicts and divisions in the community. So one space I worked, it was sort of 4 quadrants, 4 family groups. And the organisation I was based in was representing, seemed to be quite related to connected to one group. And their approach was to allow separate consultations and then bring people together and say, this is what everyone said, where can we go with this? But I think it also allows time. Others, that's a really, really tough one. Because things can get a bit volatile in some spaces, and really tough that's a tough one to negotiate, particularly and if we're talking about AOD treatment services or services, you're going to have so many different views. And I think we're seeing that with everything. We're seeing it in WA, particularly with the decisions around mining and resources. Northern Territory saw it with the Dan Murphys that Endeavour wanted to establish. They had support from both sides, and Aboriginal people on both sides wanting to, people supporting, but also people against it. And we're seeing it at the federal government level.
Yeah. We've got another one here. Any ideas or tips for working with local Aboriginal and Torres Strait Islander people, communities, and organizations that are already very busy or perhaps under-resourced in AOD policy development and not putting more strain on them?
Oh, that's where I think the time is really important. I'm just thinking of how I've sort of tried to approach some of this sort of stuff, and it's taking time and building relationships, and working through. It might start with working through certain organisations, so and they have priorities. There's priorities and I think it's yeah, it's finding some sort of pathway in. Sorry, it doesn't really answer the question, but it is I think this is stuff that can be explored, needs to be explored a bit more. Sorry.
No, that's all right. We got another one from Jackie. Statistics suggest that we are not closing the gap with the CTG. Do we need to review funding and where the money is directed? First Nations people problems need First Nations people solutions. Accountability of the government's commitment to build the First Nations workforce in mental health and drug and alcohol system. Evidence-based best practice are provisions for, provisions First Nations people need to recover with the necessary resources to rehabilitate.
Thanks, Jackie. Yeah, we aren't closing the gap. And the biggest gap there was Aboriginal people weren't included. What's really interesting in that is even the current measures don't really relate to drug and alcohol. They're all factors that sort of feed into it. But they're no directly related measures that target drug and alcohol issues, which is kind of good because it's recognising that the long-term impacts of health and of exclusion from education, employment, and all that sort of stuff actually can contribute to drug and alcohol issues. Sorry, I'm just going to try and find that question again. Yes. So I think there needs to be a commitment. I think we need accountability. We need to be able, and I think the Coalition of the Peaks has done a really good job to fight and try and get a position at the table. I don't know if the government actually would have even facilitated it or allowed it to actually recognise the need for it if we hadn't actually stood up. But we've got some these people have been fighting for decades to actually be involved. But I think the point there is about holding governments to account, and that's where having a voice to Parliament, having a treaty, and having accountability and truth telling that recognises what has happened and why we need to be able to do this. So in New Zealand, the Māori people have a treaty, and that's been translated into legislation. And if you don't hold, and under that legislation, there's a tribunal. If the government is doing anything that does not follow the treaty, which is about equality, they can actually take the government to the tribunal. We don't have that pathway here. And our rights are embedded in legislation that can change at the whim of the government. Change of government, which we saw under John Howard, ATSIC going, and it was very much a political choice standpoint. So they can pour more money in. We also need to change the other structures higher up that allow for this sort of stuff, and that needs, so in each state, I think there needs to be some really strong, not just a matter of we know what's needed, it needs to actually bring everybody along. And in WA, we don't have a department of, most states now I don't think have a Department of Indigenous or Aboriginal Affairs. They sit within the Premier and Cabinet, and it's meant to trickle down. I think that sort of mainstreaming approach might actually be hindering the futures, because you don't have people with necessary expertise in particular contexts.
Yeah.
So hopefully that answered.
Yeah, and is there room for policymakers to include cultural recommendations and considerations from First Nations workers who work at the coalface and the community who have experience at the grassroots levels, co-design consultations? How can we encourage this?
I think there is capacity for that. And I think that's where actually if we change it, like organisations actually start, I'm thinking of Mental Health Commission here in WA. If they actually start valuing and recognising the need for this, because at the end of the day, it is in WA, I think we're 4.5% of the population. That's a lot of resources to put into it, but we need to actually redress a lot of this. And I think this can be done through closing the gap and other higher structure that requires it to happen. But we've also got to remember that we've got to remember the purpose, and that it doesn't become a process focused only, that we're just doing this to tick a box. And there's some really good stuff around written about type of participation and the nature of participation, and allowing Aboriginal people to actually lead the process, or have, and it is co-design. It's almost a bit of a co-design consultation is almost an oxymoron, because co-design requires participation all the way through, but consultation is sort of can be a one-off event. And if we get stuck with consultation without any change, then it's just a tick box process. So
yeah, awesome. And yeah, we'll go with our last question.
Yep.
When policies are developed, how do we ensure that all communities are represented, given the diversity between communities?
Oh, I think that's where we actually need some really strong non-Indigenous strong structures that actually facilitate that sort of process. I think that's what Ken White was trying to do, is provide representation, but allowing things to be adapted at a local level. So it's that multi-layered approach. And so if you've got a voice, they can kind of at the top level. And it's not just a federal voice. We also look at state and territories. State and territories can do it. Local governments can do it. Organisations. It's a real funnel process, and we can start going from the grassroots up. And it's going to take a long time for everyone to be able to actually be represented. I think it comes back to identity. There's also identity stuff with that. Everybody's had different experiences, so we can't assume everyone's the same. So I hope that's answered the question.
Yeah, definitely. Yeah, thank you so much, Annalee, for presenting for us today. Unfortunately, that's all we have time for. Apologies to anyone who didn't have their questions answered today, but you're more than welcome to get in touch with us from email, and we'll respond to any questions that you have. We will be holding more webinars and putting new resources on Cracks in the Ice website throughout the year, so I would encourage you to subscribe to our mailing list at www.cracksintheice.org.au to receive any future updates. Thanks again for joining us, and I hope you all have a wonderful rest of the day.
Thank you.